Hi there everyone, it's Becky again. So this is second stage of what to expect in the counselling room. Last time it was don't expect any magic ones and be kind to yourself. Um, so I wanted to kind of walk you through a little bit of on that very first session what happens in the counselling room. So the first thing I do is I kind of introduce myself a little bit because I'm nervous and you're potentially nervous. And so when I'm nervous, I talk. So I figure if I talk a little bit, then by the time it's your chance to talk, perhaps you won't feel so nervous because you'll realize that I'm a nice person and that I'm a bit crazy. I don't know. um, so I talk about me a little bit and then I explain the contract. So, regardless of whether your sessions are funded or whether you're paying for the sessions yourself, there's a contract that we have both between the client and the counsellor and with the organisation. And essentially, on that contract, it talks through what is confidentiality. It talks through your rights and responsibilities as a client. It talks through about making appointments, sort of how to change them if you've got something coming up, um, or if you don't attend. It also talks about the sort of bigger umbrella that counsellors sit under, which is called the British Association of Counselling Psychotherapists, which essentially means that we are obliged to follow an ethical framework to make sure that we're doing everything we can to help and support you. And if you have any issues or disagreements or complaints, that you're welcome to go to that bigger body. As a client, that's part of your responsibility and rights, that if you weren't happy to be able to say that. So in essence, we would talk through the contract, get you to sign it, or if you're on Zoom or telephone, we would just verbally get you to agree that that's okay and that you understood. And if you had any problems, you'd obviously talk it through with them. The next thing that we would do is what we call an assessment. So depending on whether you're an adult or a young person, we have a form to fill out where we ask you some intrusive, nosy questions. But to be honest, I find this is a great way in because as a client, you can kind of feel this big weight of, oh my goodness, I have to talk about, the thing I rang up about or the thing I've been referred to about. And it can kind of feel like a burden and a big responsibility, and it can feel really uneasy. So with these questions, I run through them. Basically, I say yes or no, and we go through them. Have you experienced any assaults or attacks? Have you experienced domestic abuse? Have you experienced suicidal thoughts? And it gives you an opportunity to say yes, but not necessarily say anything more at that point if you don't want to. But what we're also trying to gauge in that assessment is your level of ability and readiness to partake in the counselling process, and also your risk, whether you're in danger, whether counselling at the minute is the right thing for you, or whether you need other people involved in supporting you. And we're just sort of trying to get a picture. And that can take really the whole time. And we might conclude with what we call a star. So the teen one looks like this, and the adult one looks like this. And this is to help us monitor your progress. So again, we're not trying to catch you out or trip you up or get you to sort of reveal how mentally unstable you are. It's really not about that. It's about sort of trying to gauge how you feel at the moment in terms of safety, security, feeling included, feeling nurtured, feeling safe, so that in a few weeks' time, we can review that and see if things have progressed, see if things have improved. And so essentially it's a tool we use to sort of help you and help us. So I know it's really daunting on that first session, and I know this video has been a little bit longer than normal, so I hope you're still following. But I guess I want to say it's okay to be anxious, it's okay to be nervous, scared about having to sort of bring up everything out into the open or to admit. But you don't have to go into details in that first session if you don't want to. And you can explain that actually right now you're not ready to talk about that. And it's just to give us an idea. We really are there to help you, to support you, to walk with you through your journey to make you feel better. Because ultimately that's in your hands, and we just want to support you and walk alongside you. We're not there to trip you up or catch you out. We just want to know how best to support you. So, in essence, main thing, first session is an assessment. So we would do the contract, explain confidentiality, the limitations of that, do the assessment, do the web if we've got time, and work out when your appointments would be for the next time. I hope that's helpful. Have a great day.